an obese child, okay, that was a point to be noted, was brought to the clinic by the parents with complaint of poor vision and the retina has some pigmentations. Okay, he was also referred to pediatric unit in which they found that there was hypogonadism and the mental retardation, mental processing was also slow, and the child has this. What is this? Polydactyly, multiple fingers. This is a syndrome that is one of the examples of atypical retinitis pigmentosa associated with some systemic syndrome, including obesity, hypogonadism, and polydactyly. That is known as Bartle-Biddle syndrome. Many of you were correct in this. Let me see some points. Let me tell you some points regarding atypical retinitis pigmentosa that can be associated with ocular signs only and some systemic features as well. What is retinitis pigmentosa? It's a dystrophy of rods more than cones, photoreceptors. So if the dystrophy should be there in young patient, and if rods are more affected, the first symptom is night blindness. And there are three classical features we can see in this picture. It's a classical picture of pigmentosa or typical retinitis pigmentosa, in which there is arteriolar attenuation. The arteries are thinned out. This is vein, this is artery. Arteries are thinned out. Even veins are thinned out, but artery are more affected. So arteriolar attenuation. Then waxy pallor of the optic disc, and of course you can see this black. This is pigmentation of the retina, that is bony spicules in the periphery. That's why the patient has peripheral visual field loss, that is ring scotoma. He can see from the center, that is tunnel vision. Okay, this is a typical retinitis pigmentosa, but as I say, it can be associated with some systemic features. You can remember by any of your ways. You can remember the systemic diseases like crush, BB. These are all atypical with systemic syndromes, in which the most common is Usher syndrome, in which the patient will have deafness, ataxia, neurological abnormalities. That's the most common systemic syndrome with pigmentosa. Kian-Sares, which has a mitochondrial inheritance, you study in patho. Patient has ptosis and his difficulty to move his eyeballs, ophthalmoplegia, and heart blocks. Then, if you get a question like this, if the patient has retinitis pigmentosa with this, what is this? This is in skin, you must be reading ichthyosis. That is Refsum syndrome, because phytanic acid is deposited in the skin as well as in eye. That's why phytanic diet is given. Peripheral neuropathies and palpitations are there. If the patient has pigmentosa with this, very important in histopath, what is this? This is acanthocytosis. So you can remember this syndrome is Bassan-Corvic, AAA, acanthocytosis, A beta lipoproteinemia, ataxia. Very important to be remembered. And the question for today, the child has obesity, hypogenitalism, polydactyly. The patient is Bartle-Biddle syndrome. So these are some systemic syndromes with atypical retinitis pigmentosa.